Hey everyone, how are you? How's everyone doing? Hey everyone, how are you? How's everyone doing? Can you guys hear me okay? Bueno, bueno, Jennifer. Hi, Miss Amy. Can you guys hear me okay? All right, so as long as you guys can hear me. Not too much tonight, guys. We're gonna start the series with MedSurge. We're doing allergies and autoimmune disorders in class. So I decided to just keep the flow going. All right. So not too long. I won't keep you guys too long tonight. Short and sweet. All right. So this is the disclaimer. All right. So this is called fair use and is allowed for purposes of criticism, news reporting, teaching, and parody, which does not infringe of copyright under 17 USC 107. And the views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other groups or individuals. All right, so let's begin. All right, so allergies, autoimmune diseases. That's what we'll talk about tonight. We're going to first talk about allergies, okay? The importance and the rationale behind testing for allergies. And we'll talk about a few autoimmune diseases. Not too many because I don't want to overwhelm you. So, this is the lecture for tonight. All right, so allergies, okay? Diagnostic procedures for immune and infectious disorders involves identifying destructive microorganisms. So I added this for allergies, guys, because I want you to understand that in order for us to really be able to help anyone, any type of treatment, it begins with diagnostic procedures. So if you have a patient who is experiencing constant allergic reactions, the first thing we need to do is identify the source. All right. So that's number one. If we have someone who has an allergy and they are suffering from this allergy, then the first thing we need to do is determine, okay, what's causing it. All right. A lot of patients, guys, especially now with us being able to communicate with each other, different regions of the world, different countries of the world, we understand how a small allergy can turn into maybe anaphylactic shock. So allergy tests are being done because a person doesn't want to experience anaphylactic shock. They would rather much identify the issue, the problem. So identify microorganisms in cells by examining blood. Remember that blood, body fluids, and tissue samples under a microscope. We can determine if someone has an allergic reaction by sampling the blood. We can do skin tests. We can determine if a definitive diagnosis can be gained from blood tests, bodily fluids, tissue samples. So remember, with allergies, diseases, the first thing we need to do is identify the issue first. Okay, so treatment. Once we identify the causative agent, the microorganisms, then we can treat it. So this is just a routine. You identify it and then you treat it. Okay. So sometimes there's a question on the exits or exams that state, do you do an antibiotic? Do you give a patient a broad spectrum antibiotic before you do the culture insensitivity? The answer to that is no. The first thing you need to do is find the causative agent. Okay. That's with anything as a nurse, guys. We have to figure out, we have to assess the situation before we can treat anything. All right, so let's get into it. Skin testing. Okay, skin testing. Skin testing, administration of allergen to skin or into the dermis. They'll do a patch, a scratch, or intradermal technique. This is determine exactly what is causing the allergic reactions because sometimes a person just can't pinpoint it. Now, for babies, they'll tell you to introduce one solid food at a time because then if the baby has an allergic reaction, if you have introduced that one solid food, then you can somewhat identify the source. Okay. But imagine us working adults that are we're in the elements, we walk in and out of buildings, we're constantly trying different foods, different medications, different hair products. So we don't know what is causing the allergic reaction. All right. So we'll go and we'll do a skin test. So what they'll do, they'll administration of allergens to skin or into the dermis, patch, scratch, or intradermal technique. Now, the one thing I want you guys to remember as a nurse, if you are going to be a part of the skin testing, if you're going to be the nurse that is introducing an allergen into someone's skin, make sure that you have rescue equipment readily available. Okay. Skin testing is very common, but make sure that you have some type of rescue equipment available because remember, you are administering an allergen into someone's skin. Okay. Now, skin testing, skin prick test, also called a puncture or scratch test, checks for immediate allergic reaction and to as many as 40 different substances. So, pollen, mold, pet dander, dust mite, different types of food. So, this is a skin testing. This is if someone wants to identify what is causing the issue. Why am I having these allergic reactions? But remember, as a nurse, guys, remember, you need to make sure that there's rescue equipment readily available. Okay, so the tuberculosis skin test. Okay, the mantle tuberculin skin test. So what happens is they will do an intradermal injection. They'll do a purified protein derivative. They'll inject it under the skin, and then they'll tell you to return in 2 to 3 days later. All right, they're waiting for that delayed reaction, delayed allergic reaction. Okay, it's still an allergic reaction, guys, believe it or not. Okay, but this one kind of works. This is somewhat like a controlled environment. So 2 to 3 days later, you'll come back. The healthcare worker will check for the reaction. So they're actually going to measure it to see if you have tuberculosis or not. So remember, that's a skin test as well. And that's an intradermal skin test. So the Rash test, guys, this is also to detect allergies. Okay, the Rash. They also use this to detect allergies, but there's a reason why they use this blood test. So blood tests used to determine the substance a client is allergic to. All right, it's very limited though. It's a very limited test. Blood tests used to determine the substance a client is allergic to. It's limited. Okay. They can tell if a patient has a fruit allergy, not as extensive as 40 different types of allergies, but they still do it. They still recommend it. It's not as extensive as the skin test. And let me tell you why. All right. When a patient has to take a skin test, all right, when they do the scratch or the prick, or if they'll introduce an allergen into someone's skin, remember, guys, if you're going to do a skin test, you have to tell the patient do not use any antihistamines or corticosteroids, right? But if a patient is severely ill, if they have severe eczema, or if they have psoriasis, guys, no one is going to tell them to stop taking their medications. All right. So a physician advises against the discontinuation of medication that can interfere with the test results or cause medical complications. So they'll tell this person, listen, you need to just do a blood test. Do not do a skin test because you should never stop taking your medication. Your condition is so severe that you cannot stop taking your steroids. So if you are having an allergic reaction, you need to do the Ross test. All right. So this is when a physician advises against the discontinuation of medication that interferes with the test results or cause medical complications. So if a patient has severe eczema, they'll tell them to do the Ross test. If a patient has severe psoriasis, they need to do the Ross test. They should not do the skin test. They shouldn't do the prick test, the scratch test, because in order for me to do the scratch test, and I'll go back, in order for me to do this skin prick test, in order for me to do it, okay, if I'm going to do this skin prick test, guys, that means that I can't take any antihistamines or steroids. Okay. So some people, guys, they cannot go days without taking their corticosteroids or their antihistamines. Their condition is that severe. So they can't take this, they can't do this skin prick test. They can't do the skin testing. They can't do it because the administration of allergen to the skin requires that patient to come into the office that day without taking steroids, without taking antihistamines. So some patients, guys, they cannot stop taking their medication. So they'll have to take the Ross test. All right. So I want you guys to remember that. So hypersensitivity and allergy. This is what we're discussing, hypersensitivity and allergy. Our patient is very hypersensitive. Our patient is suffering from some allergens. And it's to the point where they're like, I really need to do something about this. It's affecting my life. It's affecting my day to day. All right. So, what's a hypersensitivity and allergy? Okay. Abnormal. You see? Abnormal. Individual response to certain substances that do not normally trigger an exaggerated reaction. So, this patient may come in contact with something that causes itching and rash or tearing and burning of the eyes and the skin. So, okay, if this happens one time, okay, but imagine this is every time you walk outside, this occurs. Or pollen gives you such a severe reaction, but you don't really know it's pollen, that you can't go outside. Or some people actually leave areas because the allergic reactions are just so severe. So, hypersensitivity. So, as nurses, what do we do? How do we intervene? Because remember, we're nurses. So, what's within our scope of practice to help this patient? Identify specific allergens, encourage and make sure that we teach about antihistamines, make sure that we teach about anti-inflammatories or corticosteroids. All right. And some people do desensitization programs where they're basically desensitized. So what they'll do, they will every day or once a week, they'll go in and they'll inject a small amount of the allergen. Okay. So they'll become desensitized to the allergen. Okay. Because remember, the tearing and the burning of the eyes, some of us have to work in certain environments. Some of us have to work in the state. Some of us have to work in these areas. So we have to do what we have to do to try to adjust. Some people are, they'll do this desensitization program when they are allergic to household cleaners. They want the household cleaner. They need the household cleaner, but it's providing them with some type of allergic reaction. So they'll do some type of desensitized program. We used to do it at the chiropractor's office that I worked. We didn't actually inject anything into the patient. It was just a different type of holistic therapy. So the patient wouldn't have these allergic reactions anymore. All right. So the main reason, as a nurse, this is what I'm afraid of. Like, I understand people want to use their laundry soaps and people want to visit different areas. They don't want to have allergic reactions. So they get tested and they become desensitized. But my biggest fear is anaphylaxis. Okay. Anaphylaxis. You may have a very small or severe reaction to the shrimp this time, but the next time it may cause anaphylactic shock. Okay. You may have a very little severe, minute hypersensitive reaction this time, but the next time it may lead to a anaphylactic shock. So this is also the reason why a lot of people do allergy tests, whether it's going to be a skin test or a blood test, because they're like, listen, I do not want to be somewhere and I'm exposed to this substance and I go into anaphylactic shock. So anaphylaxis, all right, that's a life-threatening, okay, hypersensitivity reaction. So anaphylaxis, life-threatening hypersensitivity reaction with release of histamine from damaged cells. So this is a big deal, guys. So look at the assessment. I ate a piece of peanut. Now I'm having difficulty breathing, swollen tongue, flushing rash. So what it may be a little minute allergic reaction this time, but if I continue to expose myself to this same allergen, it may result in anaphylaxis. So as a nurse, I want you guys to be aware of that. Okay. Also, if you are there a part of the skin prick test or the skin scratch test, or if you're injecting an allergen into someone's skin, guys, make sure you have your medical equipment there, because the patient very well may go into anaphylaxis. So I want you guys to remember that. This is our priority as a nurse. This is what we're afraid of. Okay. So the patient will start to have hives, swelling of the lips. You see that? Swelling of the lips, tongue, throat, face, to the point where it cuts off your airway. You will not have a patent airway. You do not have an airway. Okay, swelling of the lips, tongue. The tongue will actually cut off the airway. Throat, face, tightness of the airway. Wheezing, guys. Remember that, wheezing, and chest tightness. Anxiety, and look at the blood pressure. Shock, anaphylactic shock. The blood pressure is going to decrease. The heart rate will increase to try to compensate, but it's only so much compensation that the heart can do. And nausea and vomiting. So again, this is the reason why most people, they go and they have these allergy tests. This is why, as nurses, we ask, are you allergic to this? Are you allergic to this? Because I'm not going to give it to you. Okay? Because I don't want you to go into any type of anaphylactic shock. All right. So this is the interventions. This is what you should do. If you have a patient that is exposed to an allergen and the patient is starting to have these issues, you have to establish a patent airway. You want to administer epinephrine. And I want you guys to remember this concentration, 1 in 1,000. Okay. And diphenhydramine, Benadryl, or corticosteroids. And if a patient has experienced a reaction like this, anaphylactic reaction before, they need to carry an EpiPen. They have to carry an EpiPen. Okay? They must carry it. And as a nurse, you have to encourage it. Okay? And I want you guys to remember that dose now. Remember that dose. 1 to 1,000 concentration. Latex allergies. Now, this is a big deal for nurses. This is a big deal for our patients. Okay. Latex allergy. We have to assess this. Okay. A hypersensitivity to latex. Common ways of exposure. These are like the patients that these are nurses, healthcare professionals, and also patients, guys, who have chronic diseases because they're exposed to latex in and out just like a nurse is. They are exposed to a lot of latex. So a patient who has a chronic illness, we have to assess them for the latex allergy as well. All right. They're susceptible to developing a latex allergy as well. All right. So these are going to be our at-risk individuals. These are the at-risk individuals. So healthcare workers, that's us. Individuals who wear rubber gloves frequently. And look at that, individuals with spina bifida, because they're multiple exposures. Okay? Multiple diagnostic tests. Multiple examinations. So they're exposed just like a healthcare worker. All right. Now, if a patient does not know for sure that they are allergic to latex, if they're allergic to this fruit, you may need to be very careful also with that patient with latex. I would just go to non-latex gloves right away if a patient tells me they're allergic to kiwis, banana, pineapples, tropical fruit, grapes, avocados, potatoes, hazelnuts, and water chestnuts. I'm just going to go to the non-latex gloves. Okay? So they're saying that, if you're allergic to these fruit, most likely you will be allergic to latex as well. So the latex allergy, this is something that you will see. These are the clinical manifestations. This is what you will assess when someone has a latex allergy. They're going to complain of all of these things, guys. And look at what can occur. Anaphylaxis reaction can occur. Blisters, guys. Believe it. Blisters, sores, vesicles, pain and itching, redness, itchy rash. Okay. So remember, latex allergy, it can be very severe. It can be from a red, itchy rash to anaphylactic shock. So don't take it lightly, guys. If a patient is saying that they're allergic to certain things, certain fruit, take heed. Just go get non-latex gloves. Because once that cascade starts, it's going to be very hard to stop. All right. So what you want to do as a nurse, identify clients at risk. Okay. Use latex-free products. Most hospitals now, you'll see latex-free products everywhere. All right. Provide supportive care depending on reaction. So a mild reaction, you guys know what you have to do. And for anaphylactic reaction, you guys know you need to go get some epinephrine. You need to get some corticosteroids, some diphenhydramine. You need to make sure that you establish a patent airway. So a mild reaction versus a anaphylactic reaction. So you need to react. Okay. And they don't have to convince you. If they say, I feel like my airway is tightening. Okay. Call a code. All right. Establish your airway. Go get the epi. Get some diphenhydramine, corticosteroids. Okay. You need to react. Now it's time to react. All right. So now let's go into a few, not very many. I'm not gonna overwhelm you. But let's talk about some autoimmune disorders now. All right. So if it weren't for the immune system, guys, we would be sick all the time. Okay. We need the immune system. It protects us. Okay. It protects us from external and internal. All right. So it's a complex network of cells, organs, and molecules fighting off things like bacteria, viruses 24 hours a day constantly. It's always working for us. All right. It's very powerful. It's a very, very powerful when it's working for us. All right. But it can turn against you. Your immune system can turn against you. All right. So it's called autoimmune disease. Auto meaning self, self disease. So your body is essentially turning against you, turning against self. Okay, the body is hurting self. All right. So let's talk about some laboratory tests if someone is suspected of having an autoimmune disease. All right. So maybe they're developing the signs and symptoms. Maybe something is happening. Maybe they're fatigued. They just can't figure out what's going on. Uh, Inflammation, swelling, something is going on. So they need to figure out what is going on with them. So they're going to do some laboratory tests. So I definitely want you guys to always associate this laboratory test with autoimmune disease. Okay? It's called the anti-nuclear antibody, ANA. Never ever forget that. The ANA, anti-nuclear antibody. All right? Auto antibody that is formed against normal proteins in cell nucleus. All right. So this is one of the exams that or the tests that they will use, all right, to diagnose autoimmune disease. So you'll always see this anti-nuclear antibody, all right, is used to diagnose rheumatic diseases and certain autoimmune disorders. All right. So anti-nuclear antibody. All right. Don't forget that. All right. Most people, guys, that have these autoimmune disorders, like lupus, they'll have a positive ANA. All right. A positive ANA can indicate that it can indicate other autoimmune diseases. So this is the test, guys. This is the go-to test. So let's talk about lupus, which is an autoimmune disorder. Okay. And look who it affects, guys. Look who this autoimmune disorder affects. Look at that. Female, age 20 to 40 years old, Asian, Hispanic, Native American descent. Lupus can be caused from a combination of environmental genetics. And the one thing, guys, that you must remember, if you don't remember anything else, you're going to remember ANA, and you are going to remember this butterfly rash of the face. Butterfly rash of the face. Remember that. Butterfly rash. Now, guys, lupus, no doubt, it affects pretty much every system. It can have an effect on every body system. Neurologic, cardiovascular, respiratory, GI, GU, the skin, guys. But I need you guys to remember ANA, and I need you to remember the butterfly rash. Okay? Because that is one of the things that that stands out. This is one of the things that they love to put on your exit. They love to put the butterfly rash on your NCLEX. All right, that and ANA. All right, so this is expected when someone has lupus, guys, and when they're trying to discover what is going on with me, I just don't feel the same. This patient will complain of fatigue, guys, not wanting to get out of the bed. Alopecia, so they're losing their hair, blurred vision, it affects the vision, and chest pain, pleuritic pain. All right, just from breathing, just in and out, just our regular inhale, exhale, inhale, exhale. All right, they'll start to experience some pain. All right, also weight loss, anorexia, I just don't have the desire to eat anymore. Anorexia, depression. I want you guys to remember joint swelling, guys, the joints, and just weakness. Okay. Joint swelling, guys, tenderness, anorexia, depression. So what should we do? Monitor skin integrity. As a nurse, provide frequent oral care, guys. And I know it sounds very petty, but I want you to just remember, guys, we're nurses. All right. So we have to tell the patient how to protect the skin. And we have to remember infection control. All right. So monitor skin integrity, guys, because once the skin integrity is compromised, this is going to set this patient up for a host of other problems. So I just want you to remember that. Monitor skin integrity, butterfly rash. I want you to remember that. So this is how the patient will present. This is just a scenario of how the patient may present if the patient comes in with lupus, guys. So patient is conscious, cooperative, comfortably sitting on the bed, well oriented to time, place, and person. Her BMI is 18. Her temperature is 101.5 degrees Fahrenheit. Look at her blood pressure. Blood pressure 170 over 100. And look at her BMI compared to her blood pressure, guys. Respiratory rate 15 minutes. The patient is pale, macular rash, facial puffiness, facial edema, dependent edema. Okay. So you can just tell from the clinical manifestations, okay, what may or may not be going on. So what are they going to do to kind of have a definitive diagnosis? Okay, before they mention anything, they're going to do the ANA. They're going to pull the CBC to see if pancytopenia is present. So that's too few red blood cells, too few white blood cells, too few platelets. So that's why she's so tired. That's why the fatigue and the malaise. Look at her red blood cells, white blood cells, platelets. Okay, white blood cells. That's why the frequent mouth care. Okay, platelets. Look at the platelets. Look at the red blood cells. She doesn't have any oxygen. That's why she's tired. That's why she's malaise. The BUN, guys. Okay, the BUN. Lupus does affect the kidneys, guys. So as a nurse, you want to constantly monitor the BUN, the serum creatinine. And this is another lab value that you have to remember, the ESR, guys. The ESR. Okay. This is something that they normally pull when a patient is experiencing some type of inflammation, especially from autoimmune disorders. Okay, so make sure that you guys remember that this gives you a clear picture of how the patient presents. All right, remember that. ANA, the CBC, BUN, creatinine, ESR. Okay, urine tests, presence of blood or protein in the urine, as well as the presence of red blood cell cast, guys. She can easily go into kidney failure. Lupus does attack the kidneys, guys, and kidney biopsy. All right, these are some of the tests that they will have to do. All right, so nursing care, this is us. This is what will go in the room after the patient is diagnosed. This is our role. This is what we are responsible for, providing small, frequent meals if anorexia is concerned, offer between meal supplements, encourage the client to limit salt intake for fluid retention secondary to steroid therapy, and emotional support, because guys, this is a lot. This is going to be a lot for this patient to take on and to accept. Okay, so these are the medications that you can anticipate teaching the patient about. So NSAIDs, corticosteroids, immunosuppressants, because remember, this is an autoimmune disorder. So we have to try to calm the immune system down. Okay, this is an autoimmune disorder. We're trying to calm the immune system down. And our favorite medication, this anti-malarial medication. Okay, hydroxychloroquine. All right, it's an anti-malarial. Is extremely effective for someone who has lupus. This is what the media is talking about, guys. This is the anti-malarial drug. They do use it for lupus. Okay. All right. So client education. This is what we want to tell the client. Rest. Protect your skin from the UV light, heat. All right. Protect your skin. You can use heat when for certain conditions, ice. Avoid others who are sick. and treat flares quickly. So if you are sick, guys, they want this patient to go directly to the hospital. Whenever they have flare-ups, they want them to go to the hospital. All right. So the heat, guys, is definitely for like stiffness. Okay. All right. Stiffness, because it will dilate the vessels. All right. Ice for throbbing pain, things like that. So they want the patient to rest, protect your skin for UV light, apply heat as needed, apply ice as needed, avoid others who are sick. Because remember, you're on that immunosuppressant, you're taking steroids, you should not be in crowds. Okay, you have to be very careful because your immune system is extremely compromised, and treat flares quickly. So they need to go and they need to report it to the physician right away. Okay. Now look at the complication. And this is the reason why we have to do the BUN and the creatinine, guys. This is maybe why the patient may have to have a kidney biopsy. All right. Lupus nephritis. So we're constantly checking the kidney function. Pericarditis, guys, and myocarditis. So these are all complications of lupus. All right. And our last autoimmune disorder, because I'm not going to talk your ear off because I know it's a lot and I want you guys to really go look at some videos on lupus. I want you to look at YouTube. I want you to look at some images, some people that are suffering from lupus. I want you to go look at it, okay? Now, rheumatoid arthritis, our last autoimmune disorder. So, rheumatoid arthritis, they love to pit this against osteoarthritis, two different things. All right, so the description: chronic systemic inflammatory disease that leads to destruction of connective tissue and synovial membrane within joints. All right, remember, this is an autoimmune disease. This is something that the body is attacking itself. Okay, so assessment. Look at the assessment, guys. Inflammation, tenderness, stiffness of the joints. Okay, now this is very important. This assessment: moderate to severe pain with morning stiffness lasting longer than 30 minutes. If you have osteoarthritis, guys, it's not going to take you 30 minutes for the pain to be relieved. As soon as you start moving with osteoarthritis, you'll be okay. You just have to, like you warm up an old car. Osteoarthritis is like wear and tear. All right, you start moving around, your joints start to kind of work itself out, start to loosen. You're good with osteoarthritis. Look how long moderate to severe pain with morning stiffness lasts with rheumatoid arthritis. 30 minutes. 30 minutes. Okay. So laboratory tests: rheumatoid factor antibody, ESR, C-reactive protein, ANA. All right. And it's supposed to be elevated WBCs. Okay. Elevated white blood cell. So rheumatoid factor antibody, ESR, remember ESR for inflammation, C-reactive protein, ANA again. So ANA still applies here. ANA and increased WBCs, guys. All right. So remember those laboratory tests. Remember how long it takes for somebody with rheumatoid arthritis for the pain to go away. 30 minutes, guys. 30 minutes is an autoimmune disorder. So these are the medications. The medications: NSAIDs, COX-2 enzyme blockers, corticosteroids, and make sure this goes in red: DMARDs, disease modifying anti-rheumatic drugs. DMARDs, guys. Disease modifying anti-rheumatic drugs. So they're giving the patient the corticosteroids to kind of decrease or to like they want them to become immunocompromised. They're telling the immune system, listen, you need to relax. Okay? The corticosteroids will do that. So at the same time, this patient has to be very aware of his surroundings. No going out to clubs. Okay? No exposure to things that they should not be exposed to. They don't have an immune system. Okay? And disease modifying anti-rheumatic drugs, DMARDs. So, how can we help this person? All right? How can we help them? What are some of the therapies that the physician can prescribe? So, plasmapheresis, total joint arthroplasty. Okay, guys, look at it now. Look what it says, total joint arthroplasty. And the synovectomy. So they'll remove the synovial fluid from the swollen limb, painful joint. So the synovial fluid ectomy. So I want you guys to remember that, just to give the patient some type of relief. All right, so client education. What do we do? If there's a heat or cold, apply heat or cold to the affected areas as indicated based on the client's response. So that you want them to take a hot shower, it'll help relieve some of the pain, because remember, it takes 30 minutes for this patient to get any relief. Okay? Pain in hands and fingers, they refer the patient to the paraffin wax, the heated paraffin wax. And for edema, that's for cold therapy. All right. So cold therapy. And look at all of the complications that come along with it, guys. All right. So it pretty much affects every system of the body. All right. The complication, it can become a syndrome, osteoporosis, vasculitis. So respiratory, you can have some respiratory issues or some cardiovascular issues, guys. All right, guys. So make sure that this week that you guys go and look at some videos on autoimmune disorders. Okay. Do some questions on autoimmune disorders. So just stick with rheumatoid arthritis, guys, and lupus. Those are heavy hitters. So you'll see those. Make sure that you understand those. And try to, look at some people that have really, really been diagnosed with these conditions. All right, guys. And I'll see you guys Friday. Friday, we'll do HIV. We'll do HIV, gout, and 2 more immunodeficiency diseases. All right, guys. See you then. Good night, guys.